Welcome to Solutions OP Clinical Trials Podcast. My name is Olga and I'm the Managing Director of Solutions OP. We're a small team of experienced professionals working on clinical trials in the United Kingdom. I'll use our podcast to discuss hot topics in clinical trials and provide analysis of the latest trends and challenges in pharma and medical device industries, not just in the UK but globally. Thank you for listening. Welcome to today's episode of the podcast when I will be talking about the challenges facing the research ethics committees. So it's a very good topic I'm very interested in, not because I've submitted many studies throughout the years to ethics committees, but also because I've been a member of an ethics committee for now almost 2 years. And I can see different issues and challenges that the industry has, and also different issues and challenges that the ethics committees have. So I want to kind of meet the 2 points and talk about the ethics committees in general and the issues that we have as an ethics committee and the issues that we have as an industry dealing with ethics committees. But before I discuss these challenges, I'll just give a bit of a very quick overview of the ethics committees in Europe. So I'll concentrate on Europe because I have a lot more experience working with the European ethics committees. So what we have in Europe is a mix of central ethics committees and or local ethics committees. So in some cases, you might have both. You might have a central ethics committee, you might have a local ethics committee. Even those who don't have local ethics committees, they still have some kind of hospital level regulation for the studies, to be approved and allowed to start. You need to get some hospital local level approval, even if it's not an ethics committee. Another thing that we need to understand about the ethics committees in Europe is that they can request changes in your documents. Now, this comes a bit of a surprise because I've seen companies which are based outside of Europe, and sometimes they get very surprised that the ethics committee is asking, for example, for changes in their protocol. So that comes a bit of a shock. But they can do that. Yes, ethics committees are allowed to do that. They can request changes in your documents if they spot something which is not right, or if they need you to adapt something to local regulations, because this is another thing that they need to consider when they review your study. I've seen particularly US companies, they tend to be not very comfortable with the requested changes, particularly in the protocol, because their protocols are submitted to FDA. But this is the reality. Ethics committees in Europe are allowed to request changes if they see something which is not according to the standard of care practice in the country, or if they spot some other issue. So they are allowed to do this. It's not uncommon. Another thing that we need to mention about the European ethics committees, they are often consistent of physicians and some other hospital staff. So this is why they normally charge you fees, and these fees could be quite different in different countries. In some countries, they could be quite high fees that the ethics committees charge. The other aspect is the UK ethics committee. So the UK ethics committees are a bit, should I say, unique? Yeah, they're probably unique in a way, because they are consistent of volunteers. This is something that you need to understand the difference. They're consistent of volunteers who have different background and they don't have any fees, and they're looking only at patient-facing materials. So this is a positive thing, because in a way the workload is split between MHRA and the ethics committee. MHRA is reviewing, let's say, your protocol, IB, and other documents, and the ethics committee is reviewing patient-facing materials like informed consent, any patient brochures, and so on. So the ethics committee is unlikely to ask you to change your protocol now, unless it's a study which is reviewed only by ethics committee, for academic research. Sometimes if there's something massive that is missing in your protocol, they might ask you to amend it, but generally is not that often. So what are the current issues that the industry has with the ethics committees? That's a very good topic, and I have plenty of experience throughout the years with using different ethics committees. The biggest issue is that ethics committees are different, and it's inevitable. They're consistent of different members, and of course they will be different in their approach, even on how they review studies. So some ethics committees could be a bit more picky and pick up on things that you might not necessarily feel they are very relevant, but other ethics committees could be quite okay with these things. For example, they might not necessarily pick the same things. So this is one of the big challenge, that you don't really have predictability what you can expect as a feedback from the ethics committee. It's all down to which ethics committee you've submitted and what kind of ethics committee is, what kind of members they have. The tricky part is you can't really complain about the ethics committee. And if you have a central ethics committee and you have option to choose another one where you can submit your study, that's great. But the problem is, in many European countries where you have local ethics committees, and if they have problem with your study, you need to meet their expectations, otherwise they won't approve your study. So it's very tricky. You have to make sure you satisfy all the ethics committees and their comments to get your study approved. And these comments may not be consistent, and different people could ask you different things. Another very, very big issue is the constantly increasing fees, especially in Europe. We see ethics committees are regularly raising their fees, and this is an issue. Imagine if you have like 50 sites and you have to submit to all 50 local ethics committees, and you have to pay a fee to all of them, and they all come back with different comments and questions on your protocol, and it could be quite tedious work, especially for smaller companies and startups, because they don't necessarily have the resources to do all that. So it is a challenge to work with so many ethics committees which are different, and they approach their review in a different way. And I think this is the big challenge that at the moment the industry is facing. Another big problem is it's not just the ethics committees that review the protocols and the studies in Europe, but you have the competent authorities as well. So at the end, you might have comments and questions and stuff from so many different authorities that you need to respond. So it could be quite overwhelming if you're a small company and you have limited resources. However, I want to now think from the other point of view, from the point of view of a member of an ethics committee, and what kind of issues we face and what kind of problems we have with studies which are submitted to us. So I think one of the big challenges that we see recently is that studies are getting more and more complex. For example, medical device studies, implantable devices, let's say, they could have quite complicated protocol, and it could be very difficult for person, for example, in the UK, who doesn't have the medical background to understand what's going on there. And, they have to explain how they implant the device, because this is part of the medical part. So the whole complexity of the studies is one of the challenges that we have. And you need to look through different lenses and see different ethical issues. And sometimes things are not straightforward as they look in terms of ethical problems. And talking about this, the other very, very big challenge for the ethics committees is artificial intelligence and the studies. At the moment, there are not very clear regulations around the world on artificial intelligence and what kind of requirements there should be for the companies. At the same time, there are plenty of ethical issues, if you think about it, related to artificial intelligence. And my personal view is that the ethics committees, in a way, are not prepared and not trained enough to handle that kind of studies and to deal with all the ethical concerns, because it is something very, very complex that you need to understand what is this artificial intelligence and how that works, the machine learning, to be able to actually pin down any particular ethical issue with the study. So I think this is one of the biggest challenge that we see with getting more and more artificial intelligence studies. Another thing is the constantly changing regulations. So the regulations, while they could be, similar in some areas and regions of the world, they could be quite different. And this is another big challenge for the ethics committees, because you're looking for scientific rationale for the study, and very often you don't have a scientific rationale. It's something that is requested by a regulatory agency, and you just have to do it. There's no scientific rationale behind it. So, at least not obvious one. From the regulatory agency point of view, yes, there is. But from the ethics committee point of view, maybe it's not that relevant. So these are the main, I think, the challenges and problems that we have from an ethics point of view, ethics committee point of view. But I also wanted to say I always try to be positive and say things what we can improve and how we can, have better services, because this is important for everyone who works in research, not just for the industry, but for the ethics committees as well. And I think it will be really beneficial if there are any set of clear requirements about the ethics committees, what they can and what they cannot pick up and do, and in a way set some expectations and some consistency between the different ethics committees. This will help the industry, but this will also help the ethics committees, because I think many of the challenges are just because people are not sure what is relevant to pick up. And especially in the UK, where we have volunteers, they might not necessarily evaluate, in a best way what is relevant for the study and what is not relevant for the study. So I think it's important to have this kind of even if you wanted some checklist, but clear requirements, what is important and what is not important. The other thing is, I think it's very important to have some kind of arbitrary and some kind of oversight of the ethics committees and their work, and if there are any particular issues that people from the industry can refer to that body and say, oh, look, we have this, can we have some independent review, for example. And at the moment, I don't think that kind of service exists within the ethics committees, at least not in Europe, not that I'm aware of. And I think that will be really a great thing. Especially with artificial intelligence studies that are coming, you might have a study rejected, which is not necessarily a big ethical problem, but the ethics committee somehow misunderstood it, for example, when they decide to reject it. So I think it is important to have some kind of independent professional board that can provide their input and in the review. And even for the ethics committees, maybe to be able to consult with someone if they need help and they don't understand something. I think this will be a great initiative. The other thing that could really help the industry is to have some kind of centralized ethics review, and I think this is something that will happen potentially with the coming of the new legislation in Europe and the new portal, and hopefully this will reduce the overall workload and the financial burden for the companies, particularly for the small ones where they have to pay for so many different ethics committees. And as I mentioned, I think it is very important if the ethics committees have some kind of access to experts in the field, and if they're not comfortable about something, or if they're not sure, that they can reach out to someone who works in the field and ask for advice. I think this will really help, because sometimes I know we discuss things that for someone who is a physician in the field, if they pop up and explain to us, maybe it will make a big difference, and we won't have all these questions. But in this field, it's actually ethics committees in the UK are set up in a better position, because we have at least meetings with the researchers, and we discuss with them the study, so that helps a lot, and we can learn a lot about the project. And I know that this is not an option for many ethics committees in Europe. So there is a lot of work that could be done to help the ethics committees with the challenges that they face, and there is a lot that could be done to help the industry in terms of dealing with ethics committees and feedback from different regulators. I hope this was useful information, and I'm really staying positive and hoping that this will change in the future, and we'll have a better system which will support research better and researchers as well. Thank you very much for listening.